Good evening, friends. Hope you have done well in your INI-CET, and I definitely wish you best of luck for your result also. Yes, we are here to discuss all the recall-based question. You can put input. Yes, let me open the YouTube link so that I would be remaining connected with you, because you know that these are recall questions. So if you have any input regarding any other option, if you find that different other question is there, or yes, then yes, you can comment. I will be there. Yes, sir. So first question, yes, I can check your comments also. So whatever you feel that any other option, just let me know. Okay. One patient diagnosed with schizophrenia started on risperidone. This was for sure, risperidone was there. Yes. And now suddenly rushed to emergency department with uprolling of eyeball. Okay. What is the management? Okay. What is the management? Yes, this is a very frequently asked question. Extrapyramidal symptom. Yes, if a schizophrenic patient is there and you start with first generation antipsychotic, second generation antipsychotic also can present with extrapyramidal symptom, but extrapyramidal symptoms are more commonly associated with first generation antipsychotic, but risperidone can also do that. So risperidone, this is EPS, acute muscle dystonia. Yes, I usually discuss in this way. A patient came to you in the OPD, you are sitting, you started antipsychotic. In the evening, next day, patient came to you having twisted neck. Twisted neck means torticollis, having uprolling of eyeball. Yes, oculogyric crisis, extraocular muscle. Okay, this is the earliest side effect. Okay. And patient present with torticollis, trismus. Yes, trismus means lockjaw. Patient is not able to open the mouth. Oculogyric crisis. Yes, this question was asked. Yes, uprolling of eyeball. What is the treatment of choice? Benztropine. And in clinical practice, you will find that when you are sitting in emergency, every time you give injection Finargan. You give injection Finargan, promethazine. Okay. Trade name is, or the company name is Finargan. So in this question, yes, please do comment what was given. It was benztropine or Finargan, promethazine. Yes, promethazine was given in the option. So best answer is promethazine out of these. Okay. Stop antipsychotic. You will not stop antipsychotic. You may decrease the dose of antipsychotic. The patient is exposed to the, or you can say predisposed to the extrapyramidal symptom of antipsychotic. So you will decrease the dose, but will not stop. Okay. Yes, promethazine. Yes, Satya Chandra, promethazine was there. So thank you for your response. So in this answer is, and other symptoms, yes, this is topic again I say these are clinical topics being asked more and more. So all extrapyramidal symptom you must have an idea. Yes, most common extrapyramidal symptom associated with antipsychotic is akathisia, asked previously 1 or 2 years back. So they are following the same trend is same. So expected question, and you mark the correct answer. Next is, sorry, yes, I am in little bit in hurry. Why I am in little bit hurry? Because yes, we are coming with more and more explanation of all the subjects. Okay, just like after me, Dr. Parveen would come. Yes, question number 2. I think this is again very frequently asked question. A 40-year-old man with history of alcohol intake for many years developed liver cirrhosis. Okay, please do reply if you have any other option, any other question you find that other question was also there, because it is a very short time in which I am coming live, but I collected these questions from my reliable resources, so I feel that this must be correct. Okay. Now he stopped taking alcohol, come to you with withdrawal symptoms. Treatment is, yes, lorazepam, Yes, fourth option, alprazolam. Yes, you all know when alcohol detoxification we do, you benzodiazepine we give, because benzodiazepine and alcohol act on the same receptor. Yes, GABA receptor. Okay, 40-year-old lady. In which question 40-year-old lady was there? Yes. Okay, lady. Okay, it's maybe lady, doesn't matter. We are in this question, we are concerned with liver cirrhosis, liver disorder. Yes, in this this is not a new question. Again, I am saying that not a new question. If you see the old paper of AIMS, yes, recall based question, you will find this question has been asked 3 times in AIMS. Yes, one question was, you are sitting in emergency, alcoholic patient came to you and you want to start detoxification. Which drug you will prefer? Means in emergency and you are not having a lab facility. What they ask, you don't have lab facility. If you don't have lab facility means you can't assess liver function test. That's why you start with lorazepam or oxazepam. Lorazepam or oxazepam. Yes, lorazepam and oxazepam, they are, yes, one thing. Okay. Yes, these are short acting and can be given in liver dysfunction. Why I have shown? Yes, this is not just to show you that that our notes are having, but yes, my eGurukul notes are having, this is the truth. But the main purpose to tell you is that for your upcoming exam, you must be confident whatever you are reading, that is sufficient to clear all exam if you read those notes nicely. This is the only purpose to show you, because these lorazepam and oxazepam are metabolized by liver by conjugation. So it is not affected, so they can be given, and this short acting. Chlordiazepoxide, diazepam, long acting we preferred, but if liver function test is abnormal or liver cirrhosis is there or we don't have facility, we prefer to give short acting lorazepam or oxazepam. You can go with, these are metabolized by, yes, conjugation. So in this question, answer is clear. Now third question, yes, polysomnography, you may consider it as a part of medicine, it's a part of neurology, part of psychiatry, but in psychiatry I usually discuss it. Okay, a patient on polysomnography, EEG, EOG. I want your feedback on this question, because yes, pregnant lady, there is a question of pregnant lady. Yes, yes, I will discuss that, don't worry. So they gave EEG and they gave electroculogram. So we can differentiate. Yes, you all know these are beta waves. Yes, high frequency, low amplitude. Alpha waves, theta, delta waves, high amplitude, slow wave, 1 to 3 frequency. You all know, I'm not going in discussion. Yes, and you all know REM sleep, there is, yes, body is paralyzed, means no muscle tone. Yes, rapid eye movement, eye are moving. Yes, eyes are moving, no muscle tone. Okay, body, yes, muscle is not moving. Okay, and in this sawtooth appearance of, yes, mix beta waves, alpha waves, sawtooth wave. I don't know what was the exact, please do reply. Yes, what was the picture they have shown, but let me simplify how questions are asked. If a person is awake, when person is awake, wave is beta wave, so I say this is beta wave. Yes, high frequency, yes, it was repeat question. Okay, beta wave, high frequency. In electroculogram, when you are awake, your eye movement would be there, so electroculogram will monitor this. And muscle electromyogram, not given in that question. Yes, but Yes, this muscle movement would be there in wakeful state. So this would be the picture of EEG, EOG and EMG in awake state. And NREM stage, NREM, rapid eye movement are not there. When eye movements are not there, the electrocardiogram would be flat. Okay, and there would be, yes, delta wave. Delta wave, yes, and myogram, electromyogram, little bit muscle movement would be there when we are sleeping, but in REM sleep, electromyogram would be flat. Okay, and this is, yes, sawtooth appearance, yes, mixture of alpha beta waves, and eye movement would be there. So electrocardiogram will show the eye movement. So I feel that you must have understood. Yes, in polysomnography we record sawtooth waves were given, sir. Yes, thank you. Issue sawtooth waves and ocular. NREM, yes, the options were very good. Options were NREM 1, 2, 3 and REM. So definitely answer would be yes. Yes, if actually what happens that many times when picture MCQs are asked, nobody can tell you the exact picture what was that. So let me tell you a little bit. Okay, beta waves I do remember like this: B A T D, bat D. B for bee, yes, bee, yes. Honeybee, honeybee flickers very fast. That's why I say the frequency is high in honeybee. Yes, bee, frequency is high, amplitude is low. Frequency is high, amplitude is low. Delta, yes, delta, yes. Then this is DDD, 3D. I usually say 3D. So delta 3D. So 3D. It is high amplitude and hertz 1 to 3. Okay. And between these two, alpha and theta are there. Yes. Now in stage 2, you all know K complex and sleep spindle are there. So you can easily see. Okay. So this is about this question. Answer is, for me, if it is sawtooth appearance and this is, yes, electrocardiogram, eye movements are there and sleep is there, definitely yes, REM sleep would be there. Okay, rapid eye movement, electrocardiogram. Now fourth question. A 29-year-old lady came to psychiatry OPD with symptoms of hypomania. Yes, the person has sleep problem for EEG was done. Yes, even if they do have sleep problem, actually polysomnography is done to study the sleep. So many times many aspects of sleep disorder may be there, but you can recognize the stage of sleep by simple the same concept. Okay. Yes, in this, yes, this is which should be avoided. Actually this becomes little bit controversial, not as such controversial, but I usually say yes, both lithium and valproate should be avoided. But I always say that if childbearing age group, they are planning to conceive, even if a newly married lady comes to you and planning to conceive or not, newly married female comes to you, never ever start childbearing age group valproate. This is a very common question of neurology, because the chance of neural tube defect is more than chance of Epstein anomaly. What I said, the incidence of neural tube defect with valproate is much more than the incidence of Epstein anomaly by lithium. So one to choose. If pregnancy is given, even then you will avoid valproate. If yes, in this A is better than B. Okay dear. So incidence is more, and this one question is also asked in future. They can ask, suppose a patient come to you, has started on lithium, and yes, now patient conceived, and this patient came to you, yes, after 4 weeks, 5 weeks, 6 weeks of pregnancy. Then what you will do? You will stop the lithium? No, you will continue the lithium and you will do fetal echo. Okay. So this is also question. So in this, better answer is A than B, lithium. Okay dear. Yes, this is very frequently asked question, which is exclusively seen in females. Yes, I discussed many times in child psychiatry that most of the childhood psychiatric disorder are more common in males. Yes, childhood psychiatric disorder, ADHD, specific learning neurotic disorder, Tourette syndrome, intellectual disability, autism, more common in male. Except Rett syndrome. Rett syndrome is more common in female. Previously we used to say that Rett syndrome is exclusively found in female, but few cases of Rett syndrome having present in male has been reported. But even now you can say it is yes. If the same question is asked exclusively, yes, out of these options you will prefer to go with yes this. Okay. And in Rett syndrome I usually see yes, I usually say yes. This question was there. I think one more question was there, X-linked dominant, and this is microcephaly. Rett syndrome usually have microcephaly. Yes, please do reply any other question. Yes. Yes, in Rett syndrome. Yes, in Rett syndrome. Yes, I have taken from yes, latest edition. Yes, if valproate, it is considered that the teratogenic effect is early part of pregnancy. Yes, if it has occurred, that has occurred. Okay, means now there is no benefit to stop. Yes. Yes. In Rett syndrome and Haller syndrome, you can easily differentiate that in Rett syndrome, first of all, there is microcephaly, typical feature, first thing. And they have 75% patient have seizures, second thing. And in Rett syndrome, normal development till 5 months. After that, regression. In Haller syndrome, normal development up to 2 years, then regression. Normal development up to 2 years, then regression. Okay. Regarding bipolar disease, one more question. Common in female, bipolar. Okay. Yes. Yes, bipolar जो latest according to DSM-5. Okay, I think yes, I have taken the synopsis. Yeah, they're just like childhood disintegrative disorder. This is another name of Haller disorder. Yes, Haller's syndrome. Another name is childhood disintegrated disorder. Normal development up to 2 years, then regression. Okay. Bipolar. Okay, one question was on bipolar. Yes, type 1 and type 2. Okay, yes, bipolar type 1 and type 2. Yes, datas are little bit, differing in different textbook. Let me, yes, let me tell you, bipolar 1, it is prevalence is equal. Prevalence is equal in both. Yes. Yes, prevalence is equal. Bipolar affective disorder 1, type 1, prevalence is equal. This is correct. Yes, and bipolar 2 is more common in females. It is more common in females. Okay. Why well paid? Because there is no history of rapid cycling. Okay. Age, yes, age of onset is in bipolar 1 there is, that is adolescent, late adolescent, and you can say, I can make a flow that will help you in further exam also. Yes, bipolar, yes, depression, bipolar 1 and bipolar 2. Okay, in depression it is around 30-40, 35 to 40 means middle age female, yes, and yes, age, both sex type more, don't remember. Okay. So many other options. Anyways, middle age female, depression. Bipolar 1 and bipolar 2, it is said that bipolar 2 is in late adolescent. Okay, and adulthood. It is means like this, little bit late, means depression in the last, then bipolar 1, then bipolar 2. Okay, so yes, I will recollect the question and will update you. Okay, thank you for patience listening for the time being. Yes, it is the fact. It's bipolar 1 prevalence is equal, 2 is more common in female, 2 is early age, little bit more towards higher age, that is bipolar 1, then after that is depression. Okay, so what is the exact suicide risk they have given in the option? Yes, I will confirm, then I will let you know. Okay, latest data. Okay, thank you for patience listening and contributing. Okay, thank you.